I want you to think about someone you know. Maybe it is a neighbor. Maybe it is a sibling. Maybe, if you are honest with yourself, it sounds a little like you. They feel reasonably well, not perfect, but decent. Their energy is manageable. They sleep most nights. They do not have any dramatic symptoms, nothing that would send them rushing to an emergency room. And so, year after year, they skip the annual physical. They tell themselves they will go when something is actually wrong. They figure that no news is good news, that if the body is not screaming, it must be fine. And then one day, something shifts. A symptom appears that should not be there, or a family member notices something, or a blood test ordered for a completely different reason catches something that has been quietly growing for years inside a body that never gave a single clear warning sign.
And the doctor looks at the results and says words that change everything.
If we had caught this 2 years ago, our options would have been very different. I have had that conversation with patients more times than I wish I had, and every single time I think about what might have been different if they had simply come in earlier, if they had sat in the chair, if they had let us look. Because here is the truth that gets lost in all the noise around medicine and testing and healthcare. There is a version of proactive medical care that is not about finding trouble. It is about staying ahead of it. It is about knowing your numbers before they know you. It is about catching the things that, found early, are manageable, treatable, and sometimes completely reversible. Today, I'm going to walk you through 3 medical checkups that I believe every adult over 60 must have. Not to frighten you, not to send you into a cycle of unnecessary procedures, but because these 3 screenings have some of the clearest evidence behind them for protecting health and independence. Stay with me through all 3, because the third one is the screening that many adults over 60 are still not getting, despite some of the strongest evidence in preventive medicine. My name is Dr. Elijah. I have been practicing medicine for over 30 years, and for much of that career, I have focused on the health and well-being of older adults. I have sat with patients in their 60s, 70s, and 80s through diagnoses, through recoveries, through conversations about what they wish they had known earlier, and through the remarkable moments when early detection genuinely changed the outcome of someone's life. I share what I share on this channel because I believe you deserve honest, grounded, medically sound information, delivered in plain language, without the noise. Today is one of those conversations. Let us get into it. Adults over 60 are, statistically, some of the most medically underscreened people in the country, not because they do not have access to healthcare, but because of a combination of factors that work together in a very human, very understandable way. Some have had bad experiences with doctors and lost trust. Some are afraid of what a test might find, and on some level believe that not knowing is safer. Some have watched friends go through difficult medical journeys after a diagnosis and have quietly decided they would rather not open that door. And some simply believe the message that has been absorbed culturally over decades, that after a certain age, you just have to accept whatever comes. I understand every single one of those reasons, and I am here to gently, respectfully, push back on all of them. According to the Centers for Disease Control and Prevention, approximately 80% of adults over 65 are living with at least one chronic condition, and 50% are managing 2 or more. Many of those conditions, when caught and managed early, allow people to live full, active, independent lives for decades. The same conditions, undetected and unmanaged, are among the leading causes of preventable hospitalizations, loss of independence, and premature death in older adults. The gap between those 2 outcomes, the person who lives well and the person whose health deteriorates unnecessarily, is frequently not a matter of luck. It is a matter of whether the right tests happened at the right time. Researchers at Harvard Medical School have described preventive screening in adults over 60 as one of the highest value interventions in all of medicine, precisely because the diseases most likely to affect this age group are also the diseases most responsive to early detection and lifestyle-based management. We are not talking about chasing shadows. We are talking about known, evidence-backed threats to your health, with known, evidence-backed tools for finding them before they find you. I want you to think about your body after 60 the way you might think about a house you have lived in and loved for decades. The structure is solid. The foundation has proven itself over time. But after years of use, certain systems need closer attention. The pipes may have some build-up. The wiring may be showing early signs of wear. The roof, which has weathered every storm for 30 years, may have a section that needs reinforcement before the next major rain. None of these things means the house is falling apart. It means the house deserves attentive, informed maintenance, not neglect and not panic. Just clear eyes and the right expertise applied at the right moments. Your body after 60 operates on a similar principle. The processes that quietly shift with age, changes in how cells replicate, how blood moves through narrowing vessels, how blood sugar is regulated, how tissue responds to hormonal changes, these are not failures. They are predictable physiological progressions that medicine knows a great deal about. And because we know them, we can watch for them. We can catch their earliest signs well before they become crises. The reason certain checkups matter so much after 60 specifically is because the conditions they detect tend to develop slowly, over years, without obvious symptoms, and then accelerate. High blood pressure can operate silently for a decade before producing its first dramatic event. Early colorectal changes develop gradually through stages that, if caught at the right stage, are highly treatable. Blood sugar dysregulation builds over years before crossing into full diabetes. These are not sudden ambushes. They are slow processes that preventive medicine is specifically designed to intercept. But here is the critical part. The window of most effective intervention is not unlimited. The body at 62, responding to an early finding, is not the same body at 72, responding to an advanced one. Time is always a factor. And the 3 checkups I'm about to walk you through represent the clearest, most evidence-supported opportunities to act while the window is open. The first checkup is one that the evidence says should happen every single year after 60, and yet studies show that a significant percentage of older adults skip it entirely. It is comprehensive blood pressure and metabolic panel screening. Let me explain what this actually means, because blood pressure check sounds routine to the point of being dismissed. People think, I get that done at the pharmacy, I have one of those cuffs at home, I know my blood pressure. But what I am describing goes further than a single reading on a single afternoon. After 60, blood pressure management requires consistent, patterned data reviewed by a physician who understands how aging kidneys, aging arterial walls, and aging hormonal systems interact. A single reading at the drugstore does not capture blood pressure variability, the phenomenon in which pressure fluctuates significantly across different times of day and different circumstances, and which is actually more predictive of cardiovascular risk than any single measurement. The metabolic panel, which is a blood test your doctor orders, looks at blood glucose levels, kidney function, liver markers, cholesterol fractions, including LDL and HDL, electrolytes, and other key indicators of how your internal systems are functioning. Together with a consistent blood pressure picture, this panel gives your physician a comprehensive view of your cardiovascular and metabolic health that no home device can replicate. Here is why this matters so profoundly after 60. The American Heart Association reports that nearly half of all adults over 65 have hypertension, and a significant portion of them do not know their blood pressure is consistently elevated because they feel no symptoms. High blood pressure is called the silent killer for a reason. It produces no pain, no dramatic warning signs in its early and middle stages. It simply places continuous elevated pressure on the walls of your arteries, the vessels of your kidneys, and the chambers of your heart, day after day, year after year, until the accumulated damage produces a stroke, a heart attack, kidney failure, or heart failure that feels sudden but has been building for a decade. Similarly, research published in the journal Diabetes Care has shown that a substantial proportion of adults over 60 have pre-diabetes or early-stage type 2 diabetes that is entirely undetected. Pre-diabetes, caught early, is frequently reversible through dietary adjustment, physical activity, and targeted support. Missed and progressed, it becomes a lifelong chronic condition with cascading effects on circulation, nerve health, vision, kidney function, and cardiovascular risk. The test is simple. The blood draw takes minutes. The information it provides is among the most actionable in all of preventive medicine. What to ask your doctor? I would like a full metabolic panel and consistent blood pressure monitoring, not just a single reading. Can we also look at my blood pressure variability over time? And based on these results, what is my personal cardiovascular risk profile?
The second checkup is colorectal cancer screening.
And I want to address this one directly, because I know it is the one people avoid most. I understand the reluctance. The preparation is inconvenient. The procedure feels undignified. And there is that same underlying fear. What if they find something? So people postpone. They tell themselves, next year. And next year becomes 5 years. And 5 years becomes a different conversation entirely. Here is what I want you to understand about colorectal cancer. It is the second leading cause of cancer death in the United States. It is also, when caught in its earliest stages, one of the most treatable cancers in existence. The 5-year survival rate for colorectal cancer, detected at the localized stage, before it has spread, is over 90%. The 5-year survival rate when it is found after it has spread to distant organs drops to approximately 15%.
That gap, from 90% to 15%, is the direct result of whether the cancer was found early or late.
And the reason colorectal cancer is so often found late is that it does not announce itself. In its early stages, there are typically no symptoms, no pain, no changes you would necessarily notice. By the time symptoms appear, the disease has often progressed. Colonoscopy, the gold standard for colorectal screening, does something no other cancer screening test can do. It does not just detect cancer, it prevents it. During the procedure, your gastroenterologist can identify and remove precancerous growths called polyps before they ever have the chance to become malignant. You do not just find the problem, you eliminate it in the same visit. The United States Preventive Services Task Force recommends colorectal cancer screening beginning at age 45 and continuing through age 75 for average-risk adults. For those with a family history of colorectal cancer or polyps, earlier and more frequent screening is often recommended.
Now, I want to address something important, because I know some of you may have heard or read recently that routine colonoscopy has been questioned in certain populations. The nuance here matters. For adults over 75 who are average risk, have clean previous screenings and no symptoms, the benefit to risk calculation does shift, and this is a legitimate conversation to have with your physician. But for adults between 60 and 75, the evidence for colonoscopy screening, or an alternative such as a stool DNA test, for those for whom colonoscopy is not appropriate, is among the strongest in preventive medicine. If you have been putting this off, I am asking you directly, please schedule it. The conversation with your doctor takes 10 minutes. The procedure itself takes approximately 30 minutes under sedation. The peace of mind or the early catch that changes your outcome is worth every bit of the inconvenience. What to ask your doctor?
Based on my age, family history, and previous screenings, what colorectal screening method is right for me? And if we find polyps, what would the follow-up protocol look like? If what I am sharing today is giving you a clearer, more confident picture of your own health, I want you to subscribe to this channel right now. Every week, I bring medically grounded, evidence-based health guidance designed specifically for adults over 60. Guidance that respects your experience, your intelligence, and your desire to age with full knowledge and full strength. Subscribe so you never miss a video that could genuinely matter to your life.
The third checkup is the one I want you to pay the closest attention to, because it is the most underutilized screening in adults over 60, despite having some of the most compelling evidence behind it. It is bone density screening combined with a functional fall risk assessment. Now, I know what some of you are thinking. Bone density.
That sounds like something for older women. I have heard of it, but nobody has ever really pushed me toward it. That perception is one of the most consequential gaps in how we communicate preventive health to older adults. Here is the reality. The National Osteoporosis Foundation estimates that 54 million Americans have osteoporosis or low bone density. Men account for a significant and consistently underappreciated portion of osteoporosis cases, with studies suggesting that 1 in 4 men over 80 will experience an osteoporosis-related fracture. Hip fractures in older adults are among the most medically serious events in geriatric medicine. According to research published in the Journal of Bone and Mineral Research, approximately 20 to 30% of older adults who sustain a hip fracture die within 1 year, and many who survive never fully regain their prior level of function or independence. This is not a peripheral health issue. It is one of the most life-altering threats facing adults in their 60s and beyond. And the bone loss that leads to it develops silently, over years, without pain, without any signal that something is changing inside the skeleton. A DEXA scan, which stands for Dual Energy X-ray Absorptiometry, is a simple, non-invasive imaging test that measures bone mineral density, typically at the hip and spine. It takes about 15 minutes, involves no injections, and uses extremely low levels of radiation. It tells your doctor exactly how dense and strong your bones currently are, and it allows you both to make informed decisions about whether intervention of any kind, whether lifestyle, nutritional support, or medication, is appropriate for your specific situation. But I want to go further than just the scan, because bone density testing alone is only half the picture. The other half is a functional fall risk assessment. Because the danger of low bone density is not the bone density itself, it is what happens when that bone meets a sudden impact. And falls are the leading cause of injury in adults over 65 in the United States. The CDC reports that 1 in 4 older adults falls each year, and that falls are responsible for the majority of fractures, head injuries, and injury-related deaths in this population. A fall risk assessment, conducted by your physician or a physical therapist, evaluates your balance, your gait, your strength, your reaction time, your medication profile for anything that might increase dizziness or unsteadiness, and your living environment for hazards. It is not a test you can fail or pass. It is a conversation and an evaluation that produces actionable information about what your specific risks are and how to reduce them. Clinical evidence from multiple large-scale trials has shown that targeted balance training and strength work, particularly exercises that challenge and improve proprioception, which is your body's sense of where it is in space, can reduce fall incidence by 30 to 40% or more. The combination of knowing your bone health status and proactively reducing your fall risk is one of the most powerful protective strategies available to adults in their 60s. What to ask your doctor? Based on my age, sex, and health history, am I due for a DEXA scan? And can we also do a functional assessment of my fall risk? I would like to understand both my bone health and what I can do physically to reduce my fracture risk. I want to tell you about a patient I will call Margaret. Margaret was 67 when I first saw her. She was a retired school teacher, still sharp, still social, still managing her household entirely on her own. She came to me not because anything was wrong, but because her daughter had insisted. Margaret had not had a full physical in 4 years. She felt well. She was not in pain. She exercised modestly, walked the neighborhood most mornings. She told me during that first appointment, with a slight smile, that she had been avoiding doctors because she believed that what you did not know could not worry you. I understood the sentiment, but I asked her to let us look anyway. The blood panel came back first. Her blood pressure, when we tracked it properly over 2 weeks, was consistently elevated in a range that concerned me, despite appearing normal during casual readings. Her fasting glucose was in the pre-diabetic range. Her LDL cholesterol was elevated, and her DEXA scan, which we ordered given her age and slight frame, revealed bone density already in the osteopenic range, the stage before osteoporosis, at both her hip
and her lumbar spine. None of this had produced a single symptom. Margaret felt fine. We spent time together going through what each finding meant, what the trajectory looked like if nothing changed, and more importantly, what the trajectory looked like if we addressed things now. We adjusted her diet. We referred her to a physiotherapist for a targeted strength and balance program. We started her on a low-dose antihypertensive and monitored her blood sugar closely. She became genuinely engaged in her own health in a way she had not been for years. 2 years later, her blood pressure is well controlled. Her glucose has returned to a normal range. Her bone density has stabilized. And Margaret walks into my office every 6 months with the energy of someone who has regained something she did not fully realize she was at risk of losing. She told me something at her last visit that I have not forgotten. She said, "I came in because my daughter pushed me. I stayed because I realized how much I still wanted to protect." What she meant, I think, is that getting the information changed how she thought about her future. It made it feel more worth fighting for, because she could now see exactly what she was fighting for and exactly what tools she had. That is what these checkups are. They are not about fear. They are about giving you the clearest possible picture of your own health, so that you can make real, informed decisions about how you live. Here is your clear action plan for the week ahead. The first step is to schedule an appointment with your primary care physician if you have not had a full physical in the past 12 months. Do not wait for a dramatic symptom. Make the call because you are 60 or older, and the evidence says this is the right time. When you go in, ask specifically for a comprehensive metabolic panel and a discussion about your blood pressure pattern over time, not just a single in-office reading. Ask where your cardiovascular and metabolic risk stands based on those numbers. If you are between the ages of 60 and 75 and have not had a colorectal screening within the recommended interval, raise this at your appointment. Ask which screening method is right for your specific situation and history, and schedule it before you leave. If you are a woman over 65, or a woman between 60 and 65 with any risk factors for bone loss, including small frame, family history, smoking history, or long-term steroid use, ask for a DEXA scan if you have not had one recently. If you are a man over 70, raise bone density with your physician as well. And, regardless of what the scan shows, ask for a full risk conversation. Ask what your personal risk factors are and what physical interventions are most appropriate for you. Finally, come to every appointment prepared. Write down your questions in advance. Bring a list of all medications and supplements you are currently taking, and do not leave without understanding what the results mean for your specific life and your specific goals. You are not just a patient, you are the most important person in every healthcare decision that involves your body. Advocate for yourself accordingly. I started this conversation by describing the person who waits, who tells themselves that no news is good news, who quietly hopes that the absence of dramatic symptoms means they are fine. I understand that person deeply because I have sat across from thousands of them. And what I have learned over 30 years of practice is that the people who age best, who maintain their independence longest, who stay most fully in their own lives, are almost never the ones who waited. They are the ones who looked. They are the ones who showed up at the appointment even when they felt fine, who asked the questions even when they felt awkward, who took the results seriously even when they were hard to hear, and who used the information not to become consumed by fear, but to become genuinely empowered in how they lived. Your 60s, your 70s, your 80s, these are not years to be endured. They are years with tremendous potential for meaning, vitality, connection, and contribution. The 3 checkups I have described today are not obstacles to that life. They are investments in it. Before you go, I would love to hear from you in the comments. Tell me this: is there a medical checkup you have been putting off, and what has been stopping you? Your answer might be exactly what someone else watching right now needs to hear to finally make that call. If this video helped you think more clearly about your health, please share it with someone you care about, a spouse, a sibling, a close friend who might be in that same pattern of waiting.
Sharing this video is a genuine act of care. It might be the nudge that changes someone's outcome. And subscribe to this channel if you have not already. Every week I am here with honest, evidence-based health guidance designed specifically for adults over 60. Your health deserves consistent, trustworthy support, and that is exactly what I'm here to provide. Thank you for spending this time with me. I mean that sincerely. Take care of yourselves. I will see you next week. Everything I have shared today is general medical information based on current research, clinical guidelines, and my experience in practice. It is not a personal diagnosis, and it is not a substitute for individualized care from your own physician. Before making any changes to your health routine, screening schedule, medications, or lifestyle, please consult your doctor or a qualified healthcare provider who knows your full medical history and personal circumstances.